We're doing a health care takeover show this week. Thank you so much for tuning in. We have Donna Norton, who is a healthcare champion, a healthcare superhero, a person who has helped advance healthcare more than almost any other person on the United States of America country map. Welcome, Donna.
Thank you.
So, we've been talking about how healthcare is under such deep threat right now. And what a lot of people don't realize is why. Why is Donald Trump and Republican leaders in Congress looking at the national budget and saying, oh, let's get rid of healthcare? Even though, as far as I can tell, Republicans get earaches and ear infections and Democrats do too. I mean, we all get sick. So, what the heck?
Well, you know, that seems not to be their priority to invest in our healthcare. In fact, last Friday, Donald Trump submitted his annual budget request to Congress, and it called for just a massive increase in spending for the military, like historic increase that we haven't seen in 50 years, and cuts to the Department of Health and Human Services. And so, on top of the $1 trillion they cut from Medicaid last year, they're calling for more cuts in order to fund this massive increase both in military spending and in the money that they're spending for mass detention of immigrants.
I mean, it's ridiculous. They're moving money out of healthcare to fund Trump's personal wars. They have not been actually passed by Congress, as our U.S. Constitution says that needs to happen. So they're personal wars, and we're funding that with our healthcare money, and to fund his personal attack on immigrant families, which has proven over and over again to be just a basic, absolute increase on human rights abuses. And we need safe and secure borders. But we don't need cuts to healthcare. We don't need cuts to childcare. We don't need cruelty. And in the mix, we have people who are suddenly realizing that, oh my gosh, either I'm losing my healthcare or my healthcare costs are going up astronomically. What are you hearing from Moms Rising members?
I mean, we're hearing from members all over the country who are talking about, how they're seeing cuts to home community-based services that are so important for helping moms care for elderly relatives or kids with disabilities. We're seeing, lots of people talking about how their rates of insurance are going up, how their coverage of insurance is getting worse. Lots of concern about care for elderly people in Medicaid facilities. We're hearing about health hospitals and elder care facilities closing because of lack of funding. There's about 750 to 800 hospitals, clinics, and nursing homes that are either at risk of being closed or already closed because of the cuts. So there's a huge amount of concern out there.
Yeah, so I'm hearing the concern too. People are like, wait a minute, what happened to my monthly bill? And as we've been hearing, the monthly bills are going to just go up even more because these cuts are staged over time. Like they're not going to happen on one day. They're staged to have increased cuts and come in play at different points on the calendar after the midterms. So we haven't even seen the worst of it yet. What can people do, Donna?
Well, absolutely, people can raise their voices and call their members of Congress. The thing about this bill is they need a majority of both the House and the Senate to pass it, and there's such a razor thin majority of Republicans in the House, and we're starting to hear from a lot of Republicans who are part of the kind of MAGA constituency that they don't even support these huge, giant increases for military expenditures. And so I think there's a ton of room there for people to really raise their voices and talk about how important this is to constituents. And to talk about how, gas prices are rising, people are really, we're all struggling to make ends meet in this environment where prices are rising because of gas prices, because of what's happening in Iran and in the Middle East, but also because of Trump's tariffs. and cuts to healthcare, cuts to childcare. All these costs are really huge, just pressures on all our families. And so to talk to your members of Congress and to tell them this is not making our lives more affordable. We need you to prioritize our families, our health care, our child care. This is a really great time to do it. And I think we should be able to defeat these cuts to our health care.
I agree. We should be able to defeat. We've won against all odds in the past. And I'm wondering, Donna, if you could tell us a little bit more about what we are calling to say to defeat. In fact, I'll give listeners a clue. It's more cuts to healthcare on top of what has already happened. But can you share a little bit about when we pick up the phone and call our member of Congress and say vote no, what are we telling them to vote no on right now?
Well, I mean, first of all, we should emphasize that these are our tax dollars. So we want our tax dollars to be spent to support our families, to support our health care, to support our child care, our elder care. And we don't want our tax dollars spent on funding more reckless wars, more human rights abuses against immigrant friends and families and neighbors who are critical to both our economies, our care infrastructure, and our futures. So just like that basic message, you don't need to get into the details. People just need to hear that these are our family's priorities, and we know these are our tax dollars, and they're accountable to us.
They are accountable to us at the ballot box, you all. And here's something that's really interesting. Republicans, Democrats, independents, everybody across the country actually supports access to healthcare coverage and supports expanding access to healthcare coverage, not shrinking it. And so right now we have a situation where those Republican leaders in Congress and those Republican leader who is in the White House right now are completely out of step with their own Republican constituents. That means that the math for them is not mathing. The math for us is mathing. And that means that absolutely what Donna said is true. We can win. We can stop these cuts that are expected to be proposed in the legislation that's coming up right now. Like, we need to roll back the cuts that already happened. And we need to stop the cuts that are currently proposed. Yes, we can do two things at the same time. We can walk and chew gum. Yes, that has happened. I have done it myself. I've walked and chewed gum. So we need to tell our members of Congress, reverse the past healthcare cuts and actually stop the current cuts. It's like a double thing. What do you think about that, Donna?
Yeah, absolutely. And even if your member of Congress is on your side, it just helps them so much to be able to talk to their colleagues and say, my phone is being like completely overloaded with pissed off constituents. And I'm hearing these stories and sharing your stories, and they remember the stories and they bring those stories to their speeches on the floor and when they talk to other members of Congress. So regardless of who your member of Congress is, it's really important to speak up.
150%. So how can they do that with Moms Rising?
Well, with Moms Rising, you can go to our website and sign up to be a member. It's free, and we'll just be sending you different ways that you can activate, whether it's signing a petition or sharing a story or writing a letter to the editor or making a phone call. We make it super easy, and we welcome anybody who has a belly button, moms, but everybody else. So hopefully you all will join us.
And Donna, we are in a moment where the majority of other industrialized nations actually have universal health care. They're not over here debating about what parts and pieces of healthcare are going to be cut and what parts are going to be saved. They just have universal health care. And it is frustrating, I know, to be out here kind of saying, okay, we need to save this part of the patchwork quilt that is healthcare in America, instead of saying, hello, give us an entirely new quilt that actually fits together for everyone. What's giving you hope in this incredibly frustrating moment where we're having to say the obvious? Hello, everyone needs healthcare. What's giving you hope?
Well, I think, to think back on when we were fighting back to pass Obamacare, and there was a lot of concern about universal health care, that people wanted to keep their, insurance. And I think as time has gone on, people have really realized that people really want to get to Medicare. Like people are, whether they have private health insurance or not, are relieved when they get on Medicare because they kind of know that they're in the safe zone and they can't be subject to these strange, fees that come out of nowhere, and that, everybody would like to have that level of safety and coverage. And I think we're getting to a place where we can get to that level of coverage for all Americans. So it's been a painful process, and we've made a lot of progress along the way, but I think people are realizing that what other countries have is way more efficient for our societies, and even better quality than what we have. And the amount of healthcare that is driven by profit and profit motives is very concerning in the US. And I think all of us, at least when I am told like I need a surgery or something by a doctor, I am always like, huh, well, okay, well, that could be true, but there could be a profit motive going on here. And I think none of us needs to have to be like, medical detectives to try to figure out what's best for our health. And so I think we are getting closer to that consensus.
Yeah, but we need a change, you all. Consensus is hello. We need a healthcare system that covers everybody all the time, no matter where you work or live. Healthcare is a human right. And yes, as we go toward that goal, we also need to roll back the cuts that have been made to Medicaid, to Medicare, to the Affordable Care Act, to all of the healthcare programs that have been under attack. Those healthcare programs need to be restored, and then we need to make a giant leap forward. So, or we could, restore them and make a giant leap forward at the same time. I'm okay with either option.
Yes,
But healthcare
progress
is an
in any way
emergency.
forward.
Yeah. And,
Agree.
and for so many people, healthcare is an emergency. When you need healthcare, that's the moment where you probably don't have a lot of time to lobby Congress and say, like, oh, what happened to my healthcare? So it's true that your stories are very, 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 very important. Members of Congress actually have healthcare through their job in Congress. They do not have to worry about their own healthcare. So many of them have no clue how worrisome it is to have healthcare coverage or not be on your mind all the time. So call your member of Congress, and your story doesn't have to be like, 5 hours long. It's hard for me to do a story that is less than 5 hours long. I will admit it, but it can be something really short. Like, I got sick. I had access to healthcare, so I got antibiotics for strep throat, and I didn't end up with scarlet fever, which would cost a whole lot more. I mean, it could be that short. Or it could be I got sick, I got strep throat, I ended up with scarlet fever because I didn't have access to healthcare, and it ended up costing everybody, including me, a whole lot more. Like, it could be either way. Um, so I think, there's a lot that we can do. Any closing thoughts in 30 seconds?
Well, just on your stories, we are finding that because people are so skeptical about the news right now and are turning off to like regular sources of news, that the things that are most convincing both for the public and for, members of Congress are those personal stories. They really, you can't argue with the truth of somebody really telling their own, personal story and their own emotional way. That's something that nobody can argue against. And so those stories are like gold. So thank you all for all of you who are sharing those.
Thank you so much, Donna Norton, for sharing your story, for sharing your advocacy, for sharing your leadership. And everybody go to momsrising.org and figure out how you can share your story too, because we're collecting stories all the time. Thank you so much, Donna Norton, for your leadership.
Thank you.